In current medical practice, if kidney disease progresses to kidney failure, the only option is kidney transplant or dialysis till a suitable kidney is available. Kidney failure cannot be reversed with medication. However, with the current investigation, it is possible to diagnose kidney disease very early. Lifestyle diseases like diabetes, hypertension, cholesterol, autoimmune diseases, obesity, and medications used to treating them, as well as contrast dyes used in angiograms, angioplasty, CT and MRI scanning, etc., may be the root cause of kidney damage and failure. Lifestyle diseases like diabetes, hypertension, cholesterol, etc., cannot be cured with the medication or surgical interventions like angioplasty, bypass, etc. However, if you are prepared to correct your lifestyle, it is possible to not only reverse such diseases but also reduce and stop medication needed for them. To protect kidney health and avoid dialysis and kidney transplant, it is essential to take advantage of modern investigation to identify kidney disease and take necessary steps to correct lifestyle. Here, we can learn how failing kidney health can be diagnosed very early. What are the steps that the patient should take to protect the kidney? Also, how patients at different stages of kidney diseases could avoid dialysis and the extent to which they could regain kidney health by correcting their lifestyle. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigation to assess the impact of disease on different part of the body, available treatment options in modern medicine with the benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. When we come to the kidney diseases, we should understand how the kidney is made or what is the functioning of the kidney, how it is functioning. Basically, we all know there are two kidneys, and each kidney is having around 1 million nephrons. The nephrons are the functioning units, and the nephron count can be varied. It is not fixed as 1 million in each person, but it can be varied. Someone can have a small kidney, congenital problems, or while pregnancy there is infection or any disease, autoimmune disease or metabolic diseases to the mother can reduce the number of nephrons in the child or the baby. Next is what are the functions of the kidney? First, we all know that the excretion, that is the way removing the waste, the metabolic waste, urea, creatinine, uric acid, all are the waste products. And also the medicines we are taking, that is also metabolized and removed by the kidney. And the toxins which is entering the body, even all the medicines our body considers it's all toxins. So removing that also, and the other toxins, whatever the pesticide, herbicides, or preservatives which is entering your body, that also kidney has to remove. Next is hemostasis, that is the controlling the blood composition, that is the BP control, and also the water and electrolyte balance. The kidney failure, we are suspecting if there is edema on that is water retention in the body, we will suspect a kidney disease, because excess water also kidney is removing, and the sodium, that is the salt we are taking, if it is excess, that also has to be removed by the kidney. If the salt is you are taking excess and kidney is not able to remove it, you get hypertension. Next is production. It's a production unit also. It's the hormones like erythropoietin, that is for which is controlling the production of the RBCs, and also the vitamin D. The vitamin D is produced by the skin, but it is converted into the second form by the liver, and the third most active form by the kidney. That is why the kidney disease, the bone health will be affected. Another most important hormone is renin. Renin is the hormone which is actually renin-angiotensin aldosterone mechanism. This is the three hormones That is, one is produced by the kidney and the other angiotensin produced by the liver, and the aldosterone produced by the adrenals, which is actually controlling the blood pressure. So if the kidney is affected, the blood pressure will be increasing. Next is when we come to the diseases, there is acute disease, sudden onset kidney diseases can be there, and also the chronic kidney diseases. Sudden onset kidney disease, if you are able to provide dialysis, and usually it's because of the toxins. It can be a biological toxin like a snake venom, or medicines like antibiotic, chemotherapy, radiopeptide, which is injected for the CT scan or MRI. This can give a renal failure. That is acute renal failure. Usually it can be managed with the artificial kidney. The artificial kidney, that is dialysis machine. Dialysis machine is an artificial kidney. Only thing it can function is the removal of the toxin. Usually the acute renal disease is the removal of the toxin which is affected, and if you are able to remove the toxin from the body, kidney can be in time. If you are able to do that, the kidney will regain its function, and dialysis can be stopped by a natural repair of the body. That is actually in that case we are actually supporting the body mechanisms to remove toxins so that the kidney can regain its health. Next is chronic renal failure. That is, it is usually because of other diseases, the chronic diseases which is happening in our body. Usually the lifestyle diseases like metabolic syndrome, that is obesity, diabetes, hypertension, dyslipidemia. And dyslipidemia will lead to atherosclerosis, that is fat accumulation inside the blood vessels. We always consider about the coronary artery block. Say, just like that coronary artery block, you can have the blocks in the kidney blood vessels also. Actually, most of the patients, this coronary artery block or the heart disease, they'll be having, most of them will be having hypertension or diabetes. This hypertension is because of this atherosclerosis, many of the case. And also they'll be having fatty liver or uric acid increase. And another major problem is autoimmune disease like IgA and IgA nephropathy. That is also a lifestyle disease, and autoimmune diseases like SLE, thyroid, Hashimoto's thyroiditis, even the skin disease which is affecting the psoriasis and eczema, even the varicose veins, that is also considered to be a varicose vein and vesicular ulcer. Such patients also can develop kidney disease. And chronic renal failure, it's autoimmune disease, evidently that may be affecting the skin or the thyroid, but it can affect any organ. So kidney is very gentle organ, so it can also get affected. Another thing is renal stone, kidney stone. The stone can block the renal tubes, and it can increase the pressure inside the kidney and damage the renal nephrons. And also the treatment given for that, it can also damage the kidney. It can be operative procedure or the lithotripsy, that shock waves, ultrasound shock waves are given to the stone to break the stone, and so that the broken stone will be removed through the kidney itself. So it is very powerful to break the stone. Actually, you are hitting the stone, even though you are not directly hitting it with the shock waves. So it will be hitting the this nephrons also. They are very fragile. The nephrons and the other kidney cells are fragile, and that can also get damaged. So with each shock waves or the lithotripsy, you will be damaging more and more nephrons. So after 3 or 4 or 5, there are people, I have seen that many people are 4 or 5 times the lithotripsy. That is because if you are getting renal stone, you should find out the reason for the stone. And there are methods to correct it, not to form stones. Actually, here, unfortunately, in the modern medicine also, doctors are focusing only on this removal surgery or this lithotripsy procedures. They're not really, the patient is not understand, or doctors cannot do anything. The patient has to correct their lifestyle, their food habits, and the changes, slight changes in their food habits, and can actually reduce the formation of the stones itself. But instead of even this medication for diabetes, hypertension, all will add the chance of formation of the stones, because All these things are excreted to the kidney, and this because of the concentration of these waste products, the crystallization of the stones can, there's actually it is all calcium crystallization or uric acid or specific material which is crystallized in this depositing or the crystallizes in the urine and which is forming the stone. So that can be avoided with a proper lifestyle correction. Then another reason is congenital. Congenital is kidney disease is the result of the exposure of toxins or nutritional deficiency, etc., during the pregnancy time. If the mother is taking care about like correcting the lifestyle before the pregnancy itself, because the organ formation time is the early pregnancy time, not in the end of the pregnancy alone. Early pregnancy, actually, the pre-pregnancy planning should be there, especially if there is any running problems in the family like renal failure or the father or the grandfather or grandmother or the polycystic kidney disease, etc. If they're in the family, the mother should take extra care or the parents should take extra care. Ideally, husband and wife should take care to correct their lifestyle. Then the chance of transferring it to the child will be definitely reduced, even if it is a genetically deciding factors like polycystic kidney disease. Next is reason for this kidney problems is the chronic medications we are using, and there are different type of chronic medications. Analgesic nephropathy, the most common is the NSAID, that is aspirin. In most of the after 40 years, as a prevention, as a protection for the heart, most of the people are taking aspirin. Actually, if it is also can damage the hypertension. Most of these patients who are taking will be having hypertension or diabetes or cholesterol also. Even that medicines are damaging the kidney. And also this aspirin, which is taken as a some sort of a prophylactic, but it is not really much benefit. Actually, the real benefit is we are able to correct your lifestyle and come out of diabetes and hypertension. Next is the diagnostic dye is injected. That is a contrast is injected for one is CT scan and MRI before getting real clarity, and also for visualization during the CT scan, that is applying angiogram and inserting the stent. This contrast can damage the kidney. And another thing is chemotherapy. For the cancer medicines can be very toxic to the kidney, and most of the cancer patients also will be diabetic and hypertensive. Already their kidney is damaged, and then chemotherapy dose can really, if there may be most of these patients at the initial stage, maybe in the second or third stage of renal failure, and no one is recognizing or considering that. And with that, all this diabetic and hypertension medicine, along with that chemotherapy, the poor kidney may not be able to stand all that, and they can go into failure. And evident failure. Evident failure comes only when the stage 5 renal failure occurs. Next is the other chronic medications like cardiovascular disease or the epilepsy or even the psychiatric. Epileptic patients and the psychiatric patients all is taking continuous medication, and that will also be damaging the kidney. And also the immunosuppressants and the allergy and autoimmune diseases, which is that after the organ transplant, even after the organ transplant for the kidney, that continuous medication has to be used, and that the one of the reason for the failure of the kidney itself is the these immunosuppressants can damage the kidney and after the transplant also. But unfortunately, we cannot avoid this immunosuppressants after transplant. Then another reason for the renal kidney has to be is the cosmetic. The hair dye and hair treatment, straightening, curling and keratin treatment for the kidney, and also the body care, the cosmetics which is applied on the lips and other cosmetics, and the body care which is we are always applying after this body moisturizing lotion and all. It's all contain chemicals, and it will be absorbed into the skin, and it will be damaging kidney. So if you are listed the problems which can create the problems to the kidney, because if you are testing for the kidney early diagnosis, and then you had to think of all these points and to avoid those things. Then only the early diagnosis, and you are early diagnosing and you are understanding that the kidney is under stress, then again you are continuing all these stressing factors, then it will not help you to protect your kidney. Next is, what is the early diagnosis and grading. If you are diagnosing the disease early and grade it, that is what is the stage. And for the grading, what we are for the diagnosis, RFT, renal function test, is there. It is testing many factors like creatinine, urine, uric acid, calcium, even calcium, urine, and the urine examination, albumin, red blood cells in the urine, or the pus cells, or the crystals, which is can shows the chance of stones. And from that we will be able to know what are the stages. Then we can stage the kidney by the GFR. If the GFR is okay, but there is albumin or RBC is there, or the crystals in the urine, then we will take it as a stage 1. If everything is perfect, it's stage 0. If any of the factors is the other factors other than the GFR is above 90, and other any factors is there, then grade 1. If the GFR is going down below 90, then it is taken as different stages. Grade 90, between 90 and 60, between 30 and 60, between 20 and 30. So if it is 20, below 20, it means between 15 and 30, actually 15 and 30, and different grade 1, 4B, 4A, those we are not going into such details. If it is below, usually the patient will become symptomatic with the renal disease, or the edema, leg, or discomfort starts only after if it goes below grade 5. That is, GFR is below 15. That is, you should be having GFR, that is glomerular filtration rate, should be above 90, and the kidney will not complain till it is going below, well below the GFR is 15, and that is grade 5. Even in the early stages of the grade 5, the creatinine is 4, 3.5, 4, or 4.5. There will not be any symptoms. Only if you look into that, modern diagnostic methods are so advanced, and you can check it and find out even at the stage 1 level itself. So that is the importance. And if you are diagnosing with that stage, then it is easy to correct. And only in the very late stage, the edema, that is water retention, comes. The kidney is not able to remove the water. Kidney is able to remove the potassium. So in such stage, you get symptomatic. When the kidney is able, the creatinine level goes above A7, 8. There are patients without symptoms, even without the creatinine is around 10 or above that. So that is we should understand. The kidney disease you can prevent only by testing, and your first thing is you should aware that kidney disease is a silent disease, and you will come to know about it only in the end stage, unless you are aware of such a condition and you are testing for it, and you utilize the modern testing methods and find out. And many of the labs won't give, usually the doctors also is not using the GFR they are using only in the late stage using. If the GFR is less than reduced to 80 or 70, no one is, doctors also will not be telling you your kidney is under state, because there's no treatment. No treatment means no medical treatment. There is no tablets to improve the GFR. So only method is the lifestyle correction, but that is not the doctor's job. It is the patient's job. For the doctor can give only supportive measures like decreasing edema, can give medicine, or some such things. And then next is the artificial kidney. Artificial kidney means that is the dialysis machine. It is not a complete artificial kidney. It's only to make this electrolyzer, to remove the creatinine and electrolytes and such things. It's very primitive form actually. It's a primitive form means, I mean, I'm not saying that the dialysis machine is primitive, but it is only a very minor part of the kidney functions it is corrected. That is why after the dialysis, many of the patients, especially those who are having creatinine levels 6, 7, 8, that after that stage, when it is starting dialysis also, they will feel very tired after the dialysis, because the correction of the potassium may be removed, but along with the sodium also will go down, or the chloride will also go down, or the bicarbonate. So electrolyte imbalance will not be able to correct it in the proper way. And even many of the times, 2 or 3 times also doing the dialysis, the creatinine level will be then also high, will not be able to correct the creatinine level to normal. With the dialysis machine also, you cannot correct the take the GFR to normal, even the glomerular filtration rate or such things you cannot correct. Next is renal transplant. As we know, the renal transplant has its own complications and problems, and you had to take first thing, you had to get a kidney. When close relatives donating it, they are also under stake, their health also. Or even if it's a cadaveric, means that there also, it is before the death, it is a person with a beating heart, you had to take the kidney. And so there are so much of complications in ethical and so much considerations in that. So, and also if you are able to get it also, you have to take lifelong immunosuppressant. And the immunosuppression, what is the problem with the infection and cancer and the side effects of the medicine itself, can create many problems. So why I am telling this, the problems about this, because the people has to take care of their kidney. It is so simple to take care of the kidney rather than going for the dialysis or going for the renal transplant, etc. Next, what is the real solution? We have understood that there is not much in the treatment part. It's not much to offer for even the modern medicine for the kidney diseases. Not much to offer. Then what is the real solution? Everyone should understand that this all comes in the lifestyle disease, and the reason for most of the patient who is going for the renal failure is because of the lifestyle disease and their medications. So first, for the real solution is first to diagnose it early, the renal condition. A person who's having a lifestyle disease like obesity, diabetes, hypertension, fatty liver, this or autoimmune diseases or allergy, they should check the kidney function and check the GFR. If the GFR is reduced, they should consider it's a serious problem, and they should first understand that going to the nephrologist is not a solution, because nephrologist cannot offer anything. Nephrologist can start acting only if in the late stage for the helping with the dialysis and such things only, or neurologist for a transplant. But before that, we should not reach that stage. Before that, we should correct the problems. And if you have the medication itself is damaging the kidney. If you have diabetes, control your diabetes with the lifestyle correction. Reverse your not control. Actually, you can with the medication, diabetes can be controlled only. But with the lifestyle correction, you can reverse the diabetes status. You can reverse the dyslipidemia, that is high cholesterol and triglyceride. You can reverse the atherosclerosis. You can reverse the hypertension. So reversing the disease process itself is the answer for the to protect the kidney. See, reversing lifestyle disease is not actually done by, just not those so popular, because the modern medicine is actually concentrating on the medication and surgeries. So there is not much focus in the modern medicine about the reversing the lifestyle diseases with the lifestyle correction. So basically, lifestyle correction, it should be properly, to do it properly, it should be done under the clinical support. I'm giving few examples with the clinical support, how the patients are able to come out of the renal problems and how their kidneys are functioning is improved. That is itself with avoiding other medications also. The first is a patient, is a male, 61 years, 162 centimeter height and 68.4 kg weight. He's diabetic for the 28 years and hypertension for another 28 years. Both is started together. And his HbA1c was 12.1 and creatinine is 3. And GFR is around GFR gone below. Actually, it is 16 only, 16 or 14 is the GFR actually. So he had undergone, actually he is diagnosed with renal failure after a angiogram and a stent. Actually, he had angiogram and stent put on 9/23 September. And after that only they noticed he was told that his kidney is affected. He was taking so many medication, and for the maybe some of the chest discomfort or anything, they must have gone to the hospital and done an angioplasty. And after that onwards, his kidney function deteriorated. That is, it's actually the contrast nephropathy also. It's a diabetic nephropathy is there, hypertensive nephropathy is there, and it is aggravated with the contrast injection. That is what happened for him. And even after this, his GFR, this HbA1c was very high too. So even if that he is actually was taking so many medicines, almost 13 different tablets, and many of them are combinations. He's on insulin 3 times, and also linagliptin, alpha keto analog, taurine plus acetyl, that is Nephrosil, Revelol AM, that is amlodipine plus metoprolol, that is 2 medicines for the BP, atorvastatin, 80 milligram actually, very high dose of atorvastatin, and aspirin plus pantoprazole, and Visoglor, that is ticagrelor, that is 2 are blood thinners. So if a patient who was put on a stent, then he has to continue. Even with the lifestyle correction, we cannot withdraw this blood thinners, because this blood thinners and this pantoprazole, that is an anti-acidity medicine. This blood thinners will produce acidity, and for that pantoprazole is given. And why this, in the first place, why this blood thinners is given? That is to prevent clot forming on the stent. It is a metal piece which is inserted into the coronary arteries. So there is a high chance for getting the clot on that. For that he is taking, and also he is taking, I'm not giving, for the neuropathy he is taking, and so many medicines are there. I'm not listing all these medications because it will take your time. So what happened actually? With the clinically supported lifestyle correction, actually within a week, that's diabetes medicine and diabetes injection. It's a type 2 diabetes. His insulin level was 23. It's quite high actually. So it is a type 2 diabetes. So the pancreas is producing enough insulin. So we stop for the type 2 diabetes with the clinically supported lifestyle correction. Stop the insulin and diabetes medicine in the first time. Usually within 24 hours, the blood sugar will be under control for the patient. If the patient is following the instruction correctly, blood sugar will be under control within 24 hours. And in fact, if this patient also within 24 hours, this thing be over, and almost all the medicines were by the 15th day, the medicines are over, and only that few metoprolol. Also the last, actually for the heart patients, we will stop the metoprolol, that is the beta blocker, the last BP medicine, and asked to take if any BP is at any, because of the tension or anything, BP is going high, they can take it as SOS. And for this patient, this blood thinners, this blood thinner acospirin and protopan H and this anti-acidity medicine, and the medicine has to be continued. It was put on a September, next year September, he has to continue that. All the other medicines were over within 15 to 21 days actually. Kidney, what was the kidney function? Actually, his kidney function was in the 4th stage, and it was increased, GFR was increased to 28 by the 15th day. By the 60th day, his GFR was increased to 36. So from stage 4, it was we are able to bring him up to stage 3. That is the advantage. But next, if he is continuing because of this age, we don't know how much it will can be improved. Usually, it will be can within after some more time it can be get improved to above 40 or above 50. But we cannot bring it. I don't think we are. I'm not expecting to bring him to normal renal function. That is GFR 90 will not be able to possible. But around 40 and 40 to 50 can be possible. First, we saw a patient with grade 4 renal failure, and we were able to bring it up to grade 3 and get out of all the reversing the diabetes, hypertension, and all come out of all the medicines. This is another patient. He is very young, 39 years only, and his height is 179 and weight is 86 kg. He's diabetic for the last 15 years. Now he is diagnosed with renal failure also, but in the grade 3 renal failure actually. His GFR is 41. So he's actually, his mother also is was diabetic, and she was undergoing for many few years. She's undergoing dialysis, so he's very worried, and he's having neuropathy also. He's severe neuropathy and so many problems. Not only kidney disease, the diabetes is affected his nerves, and the fatty liver is there, gallbladder polyp, and BPH, that is benign prostatic hyperplasia, retinopathy is there, gastric problems. Actually, it's almost all the systems is affected. One of the system, it is the kidney also is affected. Actually, skin lesions is there. I'm not going into all those details. And what happened for him also, he's also type 2 diabetic. Insulin level is so high, 31 is there. So stopped all the diabetic medicines, and he has even so many medicines also was there for the kidney, and even hydrolysin one BP medicine also, dihydrolysin medicine was there, amyl diabetes medicine, insulin, so many medicine. I'm also not going into the details of the medications. First, actually, in the 8th day when he came, he's only taking the BP medicine because his BP was not under that control. And then it was reduced to half, and by 30 days, all the medicines are over. Only he was asked to take if there is any BP is going high, not regularly, but when he's very tension and stress and irritability was there. When he get irritated, he can get a BP increase. So he is asked to take, if he's getting irritated, he can take a BP medicine. Otherwise, he need not, because it will be straining when the BP is okay, and otherwise he's fine. And his HbA1c has come down to 5.8 by the 60th day, and his HbA1c, this GFR, has increased to 8th day itself. So it was starting 41, increased to 45 by 8th day. By 15th day, it is 46. Then so initially it was very slow. GFR increased to 48 by the 30th day. And by 60th day, it has increased to 58. So he may be able to, I think he's in the 3rd stage of renal failure, but from 41 to 58 it was increased. And the microalbumin is disappeared actually. Microalbumin, it was heavily 1800 was the microalbumin. So all these parameters we are following it up. And the microalbumin has reduced, and even the insulin level was so high that is also creating problem for the kidney. So all these things has reversed. And if he's even his weight, actually he was 85 kg, has come down to 74. That also is very important. I'm not giving all the aspect of the patient parameters. There are a case study series is there in that similar cases with all the details, with each week, what are the changes, and what with the month, and the details of the medication and everything. I'm giving a rough idea about how the kidney diseases can be, the patients can come out of medication for these lifestyle diseases like diabetes, hypertension, and also to improve their kidney function. If it is what level we can improve the kidney function. We will go through one more patient, which is this patient is with the SLE patient. So SLE and other autoimmune diseases can also affect the kidney. And this is also very young patient, 44-year-old lady. Weight is 56 kg and her height is 145 centimeters. Short lady, but obese and hypertensive also. Most of the when this patient will be hypertensive, most of the kidney patient. Her problem was she is diagnosed with SLE 15 years. She is taking medicines for the last 15 years. And even though she is very uncomfortable, that is the thing. Her arthritis problems, her joints, actually her problem with the SLE was started with the coagulopathy, actually this deep vein thrombosis was there, and also this arthritis was there. And finally, she was on taking warfarin for this anticoagulant and HCQ, salsiptate, meclofenate twice a day, sevelamer twice a day, amlodipine, that is for the BP, sobesis for the, that is for the kidney, sompras, that is for the acidity, and inhalant Symbicort injection, that is asthmatic also. She's so many problems is there. Now she's on to all this medicine and she was crying actually. She was asked for dialysis. She is asking, why I am taking all these medicines? I was diagnosed with SLE, but I am taking all these medicine. Why then my kidney is failing? So that is the question. So that we should understand that this autoimmune disease also is a lifestyle disease. This medicines is only immunosuppressants. Your immunity is suppressed to make the come out of symptoms actually. So it is not actually helping the kidney to helping in any way or preventing renal failure, because this patient itself is a proof for that. For the SLE, if you are correcting with the medicine, only symptomatic relief will be there, and the SLE, the disease itself will be affecting your kidney, and also the medications will be affecting your kidney. And what was the result for this patient? But then we should, the patient should understand that what benefit if they do the lifestyle correction. For this, she's obese and so many problems are there. So here also we stop this, there is no diabetic medicine, so there is nothing to stop on the first day itself. Only with the symptomatic relief we stop the medicines. And within, actually she was very much uncomfortable during with all this medicine also, the joint pain and all was there. And the BP we can check and bring down the medicines, and actually she was able to come down with almost all the medicines by the 30th day. By the 30th day, she is taking only warfarin. She has to continue the warfarin because coagulopathy is there for her. It's a SLE patients with coagulopathy, the clot formation can come. So we will not stop unless the ANA is negative. This anti-nuclear antibody is the indicator of the SLE. So till the ANA is positive, negative for at least for 3 to 6 months, will not stop medicine. And also this amalong that was she was asked to take if she is taking any having BP, that is SOS, that is if the stress or something happens, she has to take that. So her creatinine, this is a grade 5 renal failure, less than 15 GFR. Creatinine was 6.8, and within actually with the even the ANA level was very high initially, 87 initially. Even the ANA level also came down. The GFR was the kidney. We cannot can look into the GFR in the grade 5 patient. The creatinine was actually by the 15th day, it was came down to 4.9. At 5.9 in the 8th day, from 6.2 to 5.5, and by the 15th day it is 4.9. So Then after that, actually, by the 30th day, I came down to 4.6 only. So then it was actually maintaining in between, according to her food and lifestyle habit, it was between 4 and 5. It is maintained, but she's totally come out of symptoms. And her weight also for the 90 days, her weight reduced from 56 to 46. So she was asked to come down to 40 actually. So if she is able to come down to 40 and if the ANA also come down to normal, then she can be thought of come down when taking the warfarin. Otherwise, she has to continue the warfarin. The other medicines are only the symptomatic medicines. So we can, according to the symptoms, we can correct it. So this patient, we are not able to bring down the level grade of the patient, but the creatinine level were able to come down, and she was able to. I think she's almost a year now. She's about not thinking of dialysis or any other uh, measures. And if she is able to maintain like this and reduce her weight to 40 and maintain like this, she can continue without dialysis, or she can continue life without any symptoms. Now, not only dialysis, without any symptoms. She's symptom free now. Even from the SLE also, that is the important thing. Not only from the kidney associated problem, the SLE symptoms is over, but we can say that SLE is completely, or the autoimmune process is completely corrected. We'll discuss one more patient. This is another type of patient, renal failure. This is IgA nephropathy. This is actually, this patient came, he's 36, very young, 36 years. He's diagnosed with for few years he knows that his proteinuria is there. Now he is asked to done a biopsy, and IgA nephropathy is confirmed, and his creatinine level is only 1.34, and albumin, microalbumin is early stage. So this is the ideal stage in which we should find out. Actually, he is watching the videos and all. Then just he checked urine microalbumin and renal function test. Then only he came to know about it. And then naturally always go to the nephrologist, and they said ask for a biopsy, and they did the biopsy, and it is IgA nephropathy, it is proved. And he was asked to take immunosuppressants like steroids and all. Then actually he came to me, and in that his GFR is 68, and many even the bilirubin was also high. Some fatty liver was also. I'm not going too much into the detail. And what was the result actually? He was not actually overweight or anything. 175 centimeters, 56 kg is the low normal BMI only. And there's no to reduce the weight reduction or nothing is needed in that way. And what was actually showing here, what is the reason for his kidney problem actually? And we look into the food allergic parameters and intolerance and all. He was allergic to milk and lemon and many common food items. So he was asked to avoid such things, and also to avoid this. His vitamins and all, his vitamin D was so low, 9 only. And he also had an insulin level high. So many other problems were also there. And his triglyceride was very high, 3 level. So such things are also there. So in the clinically supported lifestyle correction, special food and special form of exercise. And with that actually, he is able to improve his GFR to 77, from 68 to 77 by the 30th day. And by 90th day, it just came up to 95. The microalbumin was disappeared. That is, by the 8th day itself, microalbumin was cleared. And the GFR increased, and GFR, this space, it's actually in the grade 2 renal failure. Grade 2 renal failure, it just came down to 0, it's 0, that is normal status. So if this patient is going into taking this immunosuppressants and all, it will naturally, in the natural course, it will be increasing, and along with that, the immunosuppressant, the other problems will also. When he start taking immunosuppressants, his weight also start gaining. Steroids will increase the weight, and he will get into other metabolic disorders like diabetes, hypertension, and all. And finally, just like the other SLE patient, he will also land up in the renal failure. The only thing, how many years? That's all. It's a matter. it will. But with the lifestyle correction, if he is able to maintain his body parameters and things, he will not. He can continue his life smoothly and live a full life. We'll discuss another type of renal failure also. This is a uh, genetically predisposed. That is polycystic kidney disease, autosomal dominant. It's a genetic disorder actually. We'll see. We'll always think what is the role of lifestyle correction in genetic is already predisposed. It's decided that there is a problem. The genes itself or the DNA itself is showing that there is a problem. Then what is the role of this in such patients, the lifestyle correction? This patient actually, this very young lady, 30 years and 150 centimeters height, 69 kg weight. She's obese also. And she was diagnosed with the disease almost a few years back itself. By the age of 2018, it was diagnosed actually, many years back. But her problem is her GFR is going down. After the delivery, she gained weight, and with that, her renal function came down. So that is her problem. So what was the result for her? Actually, his renal function came down. It was only 53 when she came, and many other cholesterol is high, and many other fatty liver is there, obesity is there. So many other parameters are high actually. So with the lifestyle correction, actually by the 30th day, her GFR has increased to 68. By 60th day, it has increased to 75. So all the other, she was not taking much medication or anything. So there's nothing to reduce medicine. It is, and even this cholesterol level and all came down. And here also we should understand that she was able to within 90 days, by 60 days actually, she was able to bring down her weight from 68 to 57.7. So the fat level is reducing. So, and also the optimal nutrition and optimal exercise, which is actually helping her to improve her renal function. And she should actually, for her height, ideal weight should be around 40 to 45 kg. So for an Indian with this 150 centimeter and with this congenital problem and all, she should keep her weight in the low normal and avoid all the toxins like medications and this cosmetics, hair dye and such things. If she is able to maintain that, definitely she can also live a full life without affecting the kidney. But if she is not able to, not correcting, definitely this can deteriorate, and she is hypertensive, and if she is may develop diabetes, hypertension, all other things, and the medication start. And with the, even if a CT scan or MRI is needed, if a dye is injected, definitely her kidney will be going down and she can go into a renal failure. So such patients also, if they diagnose it early and take care, they can live a full life without any trouble for the kidney. In short, first, most kidney diseases can be diagnosed early. Variation in GFR, that is glomerular filtration rate, urine test, serum creatinine, blood urea, uric acid, etc., can predict the chance of future kidney failure very early. Second, when GFR falls below 90, or if there is a rise in the kidney markers like uric acid, urine albumin, urine RBC, etc., immediate attention is to be given to diagnose the underlying cause and take corrective measures to regain kidney health to prevent deterioration into complications of kidney failure, dialysis, transplant, etc. Third, the cause of 90% of the kidney disease is lifestyle disorders like diabetes, hypertension, cholesterol, obesity, etc. And the resulting damage to the blood vessels in the body and the resulting cardiovascular disease condition, together with the side effects of the medication taken for these diseases. The first step in treating kidney disease is to overcome such diseases and taper off and stop their medications by correcting lifestyle. Fourth, medicines and preservatives and chemicals in food and body care products add to the workload of the kidneys. Everyone, especially kidney disease patients, should try to reduce the entry of such toxins into the body. Fifth, it is necessary to expel the toxin accumulated in the body. This requires moderate physical activity to improve circulation, to remove toxins within and outside the cells of the body. Sixth, kidney disease patients should pay special attention to optimizing the health of other excretory organs of the body like liver, skin, mucous membrane, etc. Improving the health of the mucous membrane of the respiratory tract, GI tract, etc., helping better excretion of the toxins. Seventh, it is common for kidney patients to have liver disorders like fatty liver, cirrhosis, etc. Reducing calories, ensuring nutrition, and reducing excess fat by engaging in physical activity can help overcome fatty liver and recover health. Eighth, another important aspect is to make possible excretion of waste products through the sweat. This will reduce the workload on the kidneys and help them regain health. Ninth, it is common for kidney patients to have skin darkening and itching. The reason for this is the accumulation of toxins in an attempt to excrete waste products through the skin. 10th, everyone should make testing GFR part of their health checkup. If GFR drops below 90, the reason for this drop should be identified and correction of lifestyle should be done to remove accumulated toxins in the body and avoid the need for medication and body care products which cause the strain on the kidney. 11th, remember that medicine increases the workload and stress of the kidney. The first step in protecting kidney is to correct lifestyle and overcome chronic lifestyle diseases and the need for chronic medication. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulations can help achieve reversal of disease process, attain desired body composition, and normalize blood parameters. Based on the patient parameters, effort is directed to provide optimal nutrition, physical activity, and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle disease like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse damages, and come out of most of the medications within a month and avoid surgeries provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by the planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication, no surgery that created the disease. This is why once medication is started, very often both the disease and the medicines will keep on adding more numbers along with the unwanted side effect. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from the Government Medical College, Tirunelveli, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from the government service in 1997, started practicing as consultant at Life Care Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in the urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us, humans, but to all life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease, and come out of medications. To protect our children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends, and colleagues who are on chronic medication or planning surgery for lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. A reliable and sustainable solution lies in lifestyle modulation. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with clinically supported lifestyle modulation, etc., you may visit our healthcare channel. Thank you.